The coronavirus has now killed 323,000 Americans, including 2,200 Oklahomans. The life-threatening virus is also taking a psychological toll on those with mental distress. Our MAURO joins us now. And Mason, what are mental health experts saying about COVID-19?
Well, Karen, we see the virus causing damage on the psyche. Calls to the National Suicide Prevention Lifeline are up 800%. The Healthier Oklahoma Coalition cites 4 times more reported suicides since coronavirus struck back in March. I just spoke with a suicide survivor who tells me the only way to move forward is resiliency in the face of adversity.
This is something bad that's happening, but bad things are going to happen throughout your life.
Control what you can. Take the good days with the bad ones. Wise words from a green country mother who knows.
Wonderful times of friendship and togetherness, and horrific times of crisis and finding care.
A global pandemic snatching lives daily. Hundreds of thousands of Americans fallen victim. Extended isolation, job loss, death, all triggers for psychological trauma.
All the physical health aspects and wellness from this COVID was the first wave. And now that we're sort of developing these vaccines, the second wave, or the echo pandemic, is in mental health.
Counseling and Recovery Services of Oklahoma tells 2 Works for You it's taking 15,000 crisis calls a month, up 9,000 calls since the first days of coronavirus.
When you're already depressed and anxious and you're living in a world that feels unsafe, you don't really get a break.
Barbara HATHCOCK is wading through that world, surviving for as long as she can remember.
My son was in total denial, and he went from straight A's, the classic symptoms of changing friends, your grades drop, your smile is gone. What has happened?
Her son Keith battled anxiety as a teenager. He stored his suffering, kept it secluded from those who loved him most.
He just taped himself together and kept going as long as he could. And then at 18, he had a suicide attempt. He tried to take a whole bunch of pills.
Over the years, HATHCOCK says her only boy wrestled with clinical depression. He gritted through the pain and painted on a brave face.
It was obvious he was struggling, but he would not share that no matter how we tried.
Until one morning 30 years ago, while his wife was at church, HATHCOCK says her son decided it was time.
He had made several attempts in the past and they were not successful, and I think he made very sure that nothing was going to stop him this time.
The path to acceptance and understanding on the trail of tragedy isn't a short or straight one for HATHCOCK, as it isn't for anybody. For HATHCOCK, it's a daily duel with depression, a duel with determination she says she's destined to win.
HATHCOCK says what's helped her the most in dealing with her depression during the pandemic is staying in contact, whether that's with your loved ones, your friends, or the ones that you've lost. Officials with Counseling and Recovery Services also say it's best to talk about your anxiety rather than holding it inside. And if you need immediate help or someone to speak with about your mental health issues, the Suicide Prevention Lifeline is 1-800-273-8255. Reporting in studio, MAURO, 2 Works for You.